Hi Manal, appreciate you being here with us today. We understand you have important events lined up this week, including the panel discussion and the Human Rights Council. First of all, please introduce yourself.
Thank you so much for having us here today. So I'm an occupational safety and health specialist. I work at the Labor Administration Inspection and Occupational Safety and Health branch of the ILO. I work on a number of issues, including the management of chemicals and chemical safety in the world of work. Also, I manage a global project on occupational safety and health in small, medium enterprises. I also coordinate the World Day on Safety and Health at Work, and among a number of other issues, including our work on health promotion, psychosocial risks. And this is where the issue of violence and harassment is very pertinent, and we work on prevention of that issue in the world of work. This week was very important because we hosted a chemicals workshop, and we also had the launch of the Special Rapporteur on Human Rights and Toxics that focused on hazardous substances and on the rights of workers in prevention and protection from hazardous substances at work.
Thank you. The Centenary International Labour Conference in June has adopted the new international labour standards on violence and harassment in the world of work. It is now open for ratification by ILO member states. Could you please tell us the key features of this instrument from an occupational health and safety specialist perspective?
Obviously, as you may know, this was a very long process, and I was very privileged to be part of this process and to give some input from the safety and health perspective. It's a very strong international instrument. It's the first for the world of work. For the field of occupational safety and health, of course, we always dealt with violence and harassment. Physical violence and psychological violence are present in everyday working life. What this instrument does, first of all, is defines what violence and harassment. It gives a description of all unacceptable behaviors that could be repeated or could be singular that have an impact on our physical lives, on our psychological lives, and economic and sexual lives. And that is very important because it allows for better statistics globally, and it allows for legislation to be more specific. And it really defines that issues like mobbing, like bullying, are part and parcel of what we would consider violence and harassment at work. And for safety and health, that's important because anything that harms the safety and health of workers, be it their physical health or their mental health, is crucial. And we cannot differentiate both, as in all the declarations that we follow and the constitution of the ILO. So this declaration, this international convention gives that definition, but also continues to give a comprehensive approach to prevent and manage risks from violence and harassment.
Thanks very much. What are the key messages for companies who will be putting these principles into practice as their OSH management systems?
Yes, so we don't want to ask companies to create new systems and programs all the time. We know that there is a comprehensive OSH management system. We follow the ILO OSH management system guidelines of 2001. They follow a hierarchy of controls. So we want to be clear that it's not by patching or creating or addressing some of the issues that we are fixing the problem. We need to start with a clear risk assessment, identify if we can eliminate the source of such risks, and then have administrative controls or organizational issues in terms of violence and harassment that can prevent some of these incidents from happening. And at the very end, see how we can support workers to cope if they do happen. So we believe that our OSH management system can be applied in companies to this area, and we would like to continue to promote it. And that would start by having a workplace level policy on occupational safety and health that includes violence and harassment, or a separate one on violence and harassment depending on the size and potential of the company, of course. And then having that management commitment, because these changes really start by what managers can do and setting the example, how they treat their workers around them, and how that workers then expect to be supported, protected, in case they also come out and share information that they're going through related to violence and harassment.
Fantastic. Building on your long years of experience working as the OSH specialist, could you tell us what resources, services, as well as technical assistance the ILO could offer companies in this regard?
Yes, obviously the ILO has the privilege of setting norms around the world. So we are a normative organization, and our international framework affects legislation. So one way that we can affect countries and companies first is by supporting countries to draft legislation to protect workers from violence and harassment. These could be separate legislation pieces, or it could be included in other relevant legislation. The next phase is to set up a structure at the national level where we have tripartite bodies, we have training schools, advisory schools, surveillance mechanisms to put this infrastructure into place, and compliance mechanisms, enforcement, trained and educated labor inspectors to actually get this legislation enforced. Then at the workplace level, we can support these countries in applying OSH management systems. But to do all this, we produce a number of publications, we run a number of trainings. For example, we have our SOLVE training, which is on promoting health at work, including the prevention of psychosocial risks at work, including issues of substance abuse, nutrition, and physical activity and sleep, because they're all interrelated. And interpersonal relationships at work are very much related to this issue. We also have a checkpoints guidance. It's a checkpoints on stress, where we help countries, it's even an application on the phone, you help countries go through the various content and context-related organizational issues in a company to see if you have them in place, if they're being followed, if they need improvement. And it's a continual improvement process to see where we can fix the problem before the harm actually occurs.
Any new activity you might roll out specifically in relation to this new instrument?
Yes, I mean, before I forget, the issue of the world of work relates to third parties as well. So all kinds of harassment and violence does not only occur between workers themselves, but also from third parties and from workers towards third parties. So understanding that dynamic through this convention allows for further research. And our next steps, I would think, would be to gain enough resources and support to develop more research, understand what is violence and harassment, what is the statistics on this issue, which sectors are most affected, review the legislation that exists and how it can be improved. But more importantly, I'm happy to announce that it has just been decided that our next World Day for Safety and Health at Work of 2020, the theme will be on violence and harassment from a safety and health perspective. So we will soon start drafting some material, developing a promotional campaign to promote Convention 190 and its recommendation, and to help companies, countries, member states, workers, employees, and the representatives have the right tools and the right information to implement this convention.
That all sounds really great. Last question to you, Manal. Any message you would like to share?
Yes, I believe the field of occupational safety and health needs to think in a broader sense today. So we cannot anymore work in silos, as we all may have heard. So a safety and health specialist can no longer be a hygienist only, or a chemical industrialist, or a safety engineer. We need to understand human resources, we need to understand law, technology, and use all these disciplines in favor of issues that are affecting the safety and health of workers, including issues that are complex. So these are not physical hazards that you can assess an injury or documented. You need to look at critical events, you need to look at situations that may cause a conducive environment to such cases. And we need to remember that these are cases that cause high levels of suicide, anxiety, depression, but also physical problems such as gastrointestinal problems, diabetes, hypertension, and other issues that workers are facing due to this mental health stress at work from exposure to violence and harassment and other psychosocial risks. So broadening the discipline of safety and health and bringing together different disciplines, I think, would be the advice I would give moving forward in tackling this very important and complex issue.
Thanks very much, Manal.
Thank you.